Hi friends, we are here to discuss about a patient who came all the way from Ethiopia, a 20-year-old gentleman who was hearing only from 1 year for a very long time. This gentleman in his childhood at the age of 3 had one-sided hearing loss, which was his right ear, where he could not hear anything after a brief period of a high-grade fever and an illness which was treated back then, and following which when he and his parents realized that he was not able to hear from his right ear completely. He was absolutely fine and hearing very well from his left ear, and the patient was also communicating very well with good spoken language in his own mother tongue. And he was a very expressive guy who was leading a very normal life but listening only through his left ear. There was an unfortunate incident when he turned recently 19 years or 20 years of age, where he met with a road traffic accident in his own country. He was in a state of hospitalization with an injury to his head and required a couple of surgeries to his head. Once he woke up from this episode, he realized that he could not hear one single sound at all. Even one sound was not being described or not being expressed to be heard by the patient, and he was completely lost and shocked at the fact that he could not hear at all from the left ear, which was his only ear for hearing. The patient has moved around to many places to decide on the line of treatment for this condition, and they approached us at Aster RV Hospital. The first thing that we did was we had to do an assessment for his hearing function and also a radiological assessment to know what had happened to his skull bone, specifically the ear bone, which is called as a temporal bone, on both sides. We also knew that he has had no hearing at all in the right ear from the age of 3. When we did the scan, to our surprise and to our dismay, we found that the left ear, which was actually the working ear for a long time, now had become completely destroyed or damaged, in simple words, because of the trauma or the head injury, where the cochlea or the inner ear, which helps in hearing, had completely ossified. Ossification is basically a process of bone formation, new bone formation in the inner ear, which can happen due to meningitis, high-grade fever, fractures of the temporal bone, where there is an injury to the cochlea, and the cochlea can get completely damaged and will not have any lumen or passage left. When this was seen, we realized we could not do a cochlear implant for him in his left ear. We sat down with the family, discussed about the options, and thankfully for us, there was a chance or there was a availability of the cochlea on the right side, but the right ear was never used before for a long time, for almost a period of 16 to 17 years. The advantage that we had on our side was that he was speaking very well. His brain area, which corresponds to speech and language, was very well developed, and there was a deprivation of 1 year in the left ear following the accident. We decided to go ahead with the cochlear implant in his right ear, giving them information that the outcomes can be very variable. They can have very good outcomes, they might not have good outcomes. And this was the only option that was available to us. Once we decided to go ahead with the surgery, we had an uneventful surgery where we had a very good, complete, fully inserted electrode of the cochlear implant inside the right ear. We called the patient back after 3 weeks for a switch on. We obtained very good levels in the telemetry and the impedances during the surgery, and we hoped for the best that when we switch on we will get desirable outcomes. To our surprise and for the patient's benefit and to surprise of everyone, when we switched on, the patient started hearing immediately on the day of switch on, and he was completely in tears and he was very happy and overjoyed with the outcome that he got. He stayed with us for some time to have oral habilitation, to reorient himself to start hearing from the right ear, which he had not heard for a long time. Because of the fact that the patient had only single-sided hearing on the left side, He also had an issue of directionality where he would be able to know that it's coming from the left. Over time, that shifted to the implanted ear, which is the right side, and the patient is able to easily locate, identify, communicate, and speak in his own mother tongue and speak in his own language. This is a very good scenario for the patient where, when all hope is lost, we are able to give them some desirable or very good desirable outcomes by doing the right procedure at the right time. For more information, you can come to us and connect with us for any issues of this nature where hearing loss can be treated with the right devices and at the right time. Thank you.
My name is Jephthah Alemu. ስለ አስተር የሰማሁት እዛ ኢትዮጵያ ሆኜ ነው የሰማሁት። ነገሩኝ የዶክተር ዳሂ ቡድን ነውና እና በጣም አድርገው አሳምነው የነገሩት አሪፍ ሆስፒታል እንደሆነና አሪፍ አድርገው እንደሚሰሩ ነገሩን እና ከዛ ቀጥሎ ያለ ያው እግዚአብሔር ረድቶን ዛሬ ደርሰናል። ህመሙ የደረሰብኝ በጣም ከባድ ህመም ነው። ጭንቅላቴ ሙሉ ጭንቅላቴ ላይ የደረሰብኝ ጉዳት መስማት እንደማልችል እዛ ሀገር ቤት ሆኜ የተነገረኝ እና መስማት እንደማልችል ተነግሮኝ እዚህ ዶክተር ዳጊ ቡድን እዚህ ህንድ አስተር ሆስፒታል ሪቦ መጥቼ ሐኪሜያል። ስለ ዶክተር ረት በጣም ጎበዝና ጥሩ ዶክተር እንደሆነ ሰምቻለሁ እና ያደረገልኝም ሰርጀሪ በጣም በጥሩ ሁኔታ ነው ያደረገልኝ። በጥንቃቄ በብልህ እና ከዚህ በላይ እውቀትና ጸጋ ያብዛለት ላለው እና በአጠቃላይ አስተር ሆስፒታል ሙሉ በአጠቃላይ ማመስገን። አዎ ዳስ ኮክሌ ተገጥሞልኝ አሁን መስማት ጀምሬያለሁ። እግዚአብሔር ይመስገን። ከዚህ በላይ እሰማለሁ። በእግዚአብሔር ተስፋ አደርጋለሁ። ከዚህ በላይ በጣም እንደምሰማ ተስፋ
አመሰግናለሁ። የመጣሁት ኢትዮጵያ ነው የመጣሁት። የመጣነው ምክንያት የወፍታዬ አለሙ የኔ ልጅ ነው። አሁን እንደሚታየው እሱ አጋጣሚ አደጋ ደርሶት ነው ሁለቱም ጆሮ ጭንቅላቱ ስለተጎዳ ስለማይሰማ ነው ወደዚህ የመጣነው። መንገዱ ያሳዩን የኢትዮጵያ ያሉ ዶክተሮች ዳጊ የሚል ዶክተር አለ። በሱ ምክንያትና ከሱ ቅርንጫፎች ያሉ የሚሰሩ ሰራተኞች አሉ። ሞክረን ነበረ ብዙ 6 ወር ድረስ 7 ወር ሕክምና ቤት ሄደን ብዙ ተሰርቶ ነበረ፣ አልተሳካም። ሌላ ነገር እንኳ ቢድን ሁለቱም ጆሮ እንደማይሰማ ነው ያለችው። አቅጣጫ ስንጠፋ ወደ ህንድ ሀገር ሕክምና አስተር ሆስፒታል የምላለ እሷ ብትሄዱ ምናልባት አማራጭ የተሻለ ነገር ይኖራል ብሎ ሲነግሩን፣ ተጨማሪም ደግሞ በሚዲያም ሶሻል ሚዲያ የሰማን ብዙ ምልክቶች አሉ። ከዛ የተሰሩ ልጆች ህፃኖች በሚዲያ አይተን ነበረ። በዛም ተደምረን አጠቃላይ ወደ ህንድ እንድንመጣ መንገድ የፈጠሩ እነሱ ናቸው። ግን ተጨማሪ ደግሞ እዚህ ስንመጣ ያገኘነው ሕክምና በጣም ደስ የሚል ነው። የተሻለ ሕክምና ነው ያገኘነው። እሱ ሕክምናው ታይቶ ዶክተሩ ታይቶ ብዙ አቀባበል ነው ያደረጉልን። አቀባበላቸው እንኳን መጀመሪያ ላይ እስከ አየር ማረፊያ ድረስ መጥተው የራሳቸው መኪና ይዘው ወደ ሆስፒታሉ ድረስ ያመጡ እነሱ ናቸው። ስንገባ ምርመራ ተጀመረ። እንኳን ብር እንኳን ሳይመጣ ሳይተላለፍ ነበር። ስንመጣ በብድር ነው ስሩ እንኳን ስሩ መጀመሪያ በብድር ሰርቶ ከዛ በኋላ ነው ብር ራሱ ይገባ። ከዛ ሕክምና ቀጠልን። አየን ኤምአር ማሽን ተነስቶ ሁሉም ነገር ካለቁ በኋላ ሰርጀሪ ሊደረግ ዶክተር ሪወት ዶክተር አለ። አንገት በላይ ጭንቅላቱ ለምሳሌ ሁለቱም ጆሮ ለመተው የሚችል እሱ ነው ተብሎ ወደ እሱ መራን። እሱ ስንገባ ዶክተር ነው ምን ብዬ ያው ሌላ መጨመር ነገር ስለሌለ ነው እንጂ ከዚህ በላይ ልናገር እችላለሁ። ዶክተርነቱ በጣም ጎበዝና በጣም ታታ ዶክተር የሆነው ሳይሆን እንደ ልጆች ነው አብሮ ከኛ ጋር ተደረገው። ጥሩ ዶክተር ነው። ሰርጀሪ ሲደረግ እንኳን ከዚህ በፊት ኢትዮጵያ የተሰራው ሰርጀሪ እና እዚህ ስንመጣ የተሰራው ሰርጀሪ ይለያል። ምክንያቱም ቁስል የለም፣ ምን የለም፣ ጠባሳ የለም፣ ምንም ያልታይበት ስራ ነው የሰሩት። ከዛ በኋላ ነው ሕክምና ሲደረግ ኮክሌር የሚል መሳሪያ አለ። እሱን በጭንቅላቴ ውስጥ ስንተክል መስማት ይችላል ሲሉ ሲነገሩ እሺ ብለን ገባን። እሱ ሲጨመሩ አሁን ያ መሳሪያ ሲጨመር መስማት ጀምረዋል። የተወሰነ ደረጃ ቢያንስ ከ150 160 በላይ መስማት ጀምረዋል። በፍጹም አይሰማም። ጉዳቱ በጣም ከፍ ያለ ነው። 6 ወር ሙሉ ሳይሰማ ሁለቱም ጆሮ በምልክት ነው የማይሰማ ሰው እንደሚደረግ በምልክትና በእጅ እየነካካን ነው የምንላለን። አሁን ግን ድምፁን ሰምቶ ብላ ስንል ብዙ ነገሮች የራሱን ስም ስንጠራ ሰምቶ መልስ እየመለሰ ነው። መስማቱ እኮ በጣም ደስ የሚልና በጣም የተሻለ ውጤት ነው ያገኘነው። ሆስፒታሉ ራሱ ይህንን መስለኝ ባለም ደረጃ ያሉ ሆስፒታሎች ምንም ብዬ ልንገረው ብዬ እንጂ ለምን ምናልባት ሌላ ሀገር ያሉት ካለ ስላልተረዳው እንጂ በጣም የተሻለ ሆስፒታል ነው ብዬ ነው የማስበው። ምክንያቱም አጠቃላይ ሕክምና ጀነራሉ አጠቃላይ ሕክምና ራሱ ሲያየው በጣም ጥሩ ሕክምና ነው የምናገኘው። እዚህ ብዙ ሰዎች ቢመጡ እንኳን የተሻለ ሕክምና የተሻለ ነፃነት ያገኛሉ ብዬ አስባለሁ። ከእግዚአብሔር በታች ዋና እግዚአብሔር እንኳን ቢሆን ከታች የሚሰሩ በዓለም ላይ የሚሰሩ ሕክምናዎች ያገኘነው በእኛ ምክንያት የተነሳ የመጠነው ያየነው የሰማነው ነገር አሰባናችን ያየነው በጣም የተሻለ ሕክምና ማግኘታችን ነው። ከኛም አልፎ አሁን እንደዛ ያለ ችግሮች እንኳን ያሉ ሰዎች እንኳን ቢኖር መስማት ችግር አለ፣ ሌላ የሆነ ምክንያቶች አሉ፣ በአገር ቤት የሚቸገሩ ሰዎች እንኳን ቢኖሩ እዚህ ሕክምና ቢያገኘው በጣም የተሻለ ነው ብዬ አስባለሁ። ሌላ ደግሞ ለዶክተሩ እኮ የምናገረው ነገር የለኝም፣ ቃላት የለኝም። እስካሁን እየደወለ እንዴት ነው እያለ የተሻለ ነገር አለ፣ ለውጥ አለ፣ ምን አለ እያለ እስከ መከታተሉ ራሱ ጥሩ ነገር ነው ያገኘነው። ሆስፒታሉና ዶክተሮቹና ከዛ ራሱ የመጠንበት መንገድ የሚያሳየን ልጆችና ዶክተሮች ሁሉ በጣም ምስጋና አለን። በተጨማሪ ሆስፒታል ለእነሱ ከፍ ያለ ምስጋና አለን። አመሰግናለሁ።
Thank you.